Just because it's so important and we get so many messages regarding that, we'll revert once more to what I think it remains the hot topic in BBL surgery, that is the safety discussion. In brief, what is BBL actually about? It's an extensive liposuction and means transfer of fat to the buttocks. Sounds good, is good. It's the fastest growing procedure ever in the history of plastic surgery. I think it's an extremely powerful procedure when it comes to changing your body proportions, and what patients love about it, that you achieve a curvy look, or what people call a body feminization, or great. And what doesn't make things better is currently living an enormous social media hype, which is not a bad thing. But if an inadequate fat injection technique is used, there is a risk of something that in the surgical community we know as lethal fat embolism. And the classical pathway for this, and this is what the BBL discussion is all about, is a bolus injection of fat with a syringe and a thin cannula into the muscle, which can then form a so-called macro fat embolus to the heart. And this is a potentially lethal complication. Now, we learned about this in years ago, and there was a huge uproar in the surgical community, and that was actually before the procedures really started to become so popular in Europe. And the response of the International Society of Plastic Surgeons was to say, okay, don't inject into the muscle, don't use thin cannulas and syringes. So far, so good. However, then in a second step, there were a couple of incidences involving UK patients abroad experiencing that horrible complication of fat embolism, and suddenly public interest in this complication rocketed through the roof, although, of course, it existed before. So the continuing action of the Bridge Association, the BAPS, we all know the BAPS decided basically to say, no, don't do that. I'm extremely critical of this, and I remain critical for a simple reason, because people will not stop doing it, because the BAPS says no, but they will continue to go elsewhere. And this is why I'm actually very, very thankful for the possibility that BAPS gave me and a few other guys with a high caseload experience in BBL surgery. That was actually in 2019. They kindly and fairly invited us to London to come and give our view, and our view is you can learn to do this procedure safely. So training the procedure is better than banning the procedure. And the first thing, just to demystify the view on BBL a bit, is to understand what is the problem. And the problem is shown in this picture. If somebody comes from the infragluteal fold with a syringe, and the syringe cannula is thin and goes into the muscle, this is what can potentially cause the problem, because you have no palpation control of the syringe tip. You might think you have, but you don't. So you want something that gives you safe control. So how do you avoid it? You want 100% undisrupted palpation control on the tip. So you want to avoid to use syringes. You don't want easily perforating fine tip cannulas, and you want a continuous flow stream injection instead of bolus injections. And to achieve this best, you want to use blunt white tip basket cannulas. And what we suggest adds on top to this is ultrasound mapping of the subcutaneous tissue layer, so you know where you actually are. In summary, what gives an answer to all these issues is expansion vibration lipofilling, which was invented by Dr. Danny Del Vecchio from New York, and it entails use of rigid, blunt, basket-type cannulas where you have complete control of your cannula position by palpation, avoiding bolus injection. So this is learnable and trainable. So to make this a bit more visual, you see the vibrating handpiece, and you see the tube or the fat is passing past the vibrating handpiece. and you inject with such a vibrating basket type cannula, which will then enable you to control the inflow of your fat at all material times. And this is what I consider as bulletproof against fat grafting. What we've done to perfectionize it even a bit more, you can measure the subcutaneous tissue thickness before the procedure with ultrasound, and you see a little short demo how that works. You see the crosses are the marking of the subcutaneous fat thickness that we've done before. This is a continuous infiltration pump, and the motors for the vibrating handpiece. And you see here how the fat kind of is swelled into the subcutaneous tissue, and you have at all material times, at every second during the procedure, you have control of the position of your cannula. So it can't bend and it can't go into the muscle by accident. A further alternative to this, if you want to take it even one step further, is to use a so-called hybrid technique. So in the space where the veins are, which is inside the muscle, you actually put a silicone implant, which then I couldn't possibly imagine how you would want to cause fat embolism with that. But again, if you just do fat grafting with expansion, vibration, lipofilling technique, I submit to you, you can do that very, very safely. And this is a controllable issue. So we hope for both patient and also for interested surgeons who are getting more and more people who want to get their hands on this procedure, that this gives you an insight and the confidence that you can do this at a very, very good safety profile. And again, we invite all our peers to our next live surgery course, where we will, like always, center on large volume lipofilling and have some really cool surgeons here presenting their different technical approaches live. So we hope to welcome a cool crowd for that in September in Marbella.